So I'm Ros O'Neill. I'm Head of Health and Wellbeing and Stress Lead at Oxford Health NHS Foundation Trust in Oxford. I'm also the Clinical Lead and Advisor to the Enhanced Occupational Health and Wellbeing project across Buckingham, Oxfordshire and Berkshire West, Bob ICS. As an ICS, Bob were very lucky to be awarded some money to enable them to do the Enhanced Occupational Health and Wellbeing project. What that money did was it enabled us to support all our wonderful colleagues across the ICS, of which there's 38. We have the Oxford University Hospital, Buckingham Healthcare, SCAS, Oxford Health Foundation Trust, Berkshire West and Royal Berkshire. We also have our CCGs within our ICS. What we were able to do with the money and to help support all these colleagues was we brought in a project manager, a wonderful project manager, and we were able to put 6 project leads based within each organisation as an additional resource to help drive what our aim and ambition was, which was really to implement a sustainable wellness culture. And one of the first things we did was we done a gap analysis across the whole system using the health and wellbeing framework. And what that did was, yes, it gave us a clear understanding of what we offered, but what it didn't do was give us an understanding of, we know what we're offering, but what does people on the ground truly know? What do we know if they access things? Do we know if it was helpful or not? So one of the first things we done with our project leads in each trust was to dig deeper and collate data, to understand and triangulate that data to get a clearer picture. And what that actually did was it changed some of the RAG ratings of what we offer. And we know we offer it, but what do people actually understand and what do they know about and how useful is it? So that was the first thing that gave us, as an ICS perspective, a real understanding of where gaps were, where we may need to level up, and what truly does the people on the ground need to help support them from a wellbeing perspective. So what we also identified at that time was we knew locally, regionally and nationally that all the offers of support were there. But what we did need to do was really push and promote the basics. And at the same time, what came along was every ICS, including ours, got funding to set up a mental health and wellbeing hub. And we work collaboratively with You Matter and Wellbeing Matter across our patch. It's been invaluable. So we've got that additional support. So what we agreed as a project team was, we know the support's there, we know we need to promote it more. We've already got our mental health and wellbeing hubs in place. We commissioned Academic Health Sciences to do an evaluation for us. So what else were we going to do? And what we identified was, we know the support's there. What we need to do is something to ensure we get the support out there. And also what we wanted to do as a big priority was to implement some stuff that was going to be preventative, proactive and sustainable, and then a vehicle for getting that information out. So in effect, to try and stop or limit potential harm that may be affecting, and especially emotional wise, our colleagues across the system. So to that end, what we did was we were able to train 73 colleagues across the ICS in a restorative just learning culture, which is the start of removing blame in learning, and it's about patient safety, because all of this, while we talk about well-being and it's for our colleagues, we know it's intrinsically linked to the care we deliver and how patients receive care in their experience, and that really is why we all come to work. So by implementing in starting the journey of the restorative just learning culture, we were able to start the process of shifting blame when things go wrong to, can we learn from them? Can we take appropriate approaches, and can we start to prevent any damage that may be caused to staff who are going through this process? So we've done that. We've also been really lucky to set up a pilot with support from NHS E&I for a community of support for all those trained in restorative just learning culture. What we also identified was we wanted to empower our managers, because we see our managers as a major support to colleagues who can help, who are there on a day-to-day basis and support their colleagues. So we wanted to give them the tools to enable them to identify when either staff really aren't well psychologically, maybe struggling, and how to have these caring, compassionate conversations. So we were able to train 80 colleagues across the system. As well as that, we're implementing 5,000 training courses for React to enable that wellbeing conversation and to empower managers again, and to get the foundations of that caring, compassionate and understanding conversations. Another thing we done was we were able to put in place 26 courses to train up TRIM colleagues in the understanding of TRIM, and really that's for clinicians, non-clinicians, just to be there to help identify and support colleagues who may be going through a difficult experience, or there's been a traumatic or a difficult incident within teams or within areas. Some of the other things that we've done from a health perspective, and more a physical health perspective, is we're just going through the process of commissioning health kiosks. So we're commissioning 8 across the system. These will be mobile and can be placed within each organisation. Collaboratively, what we've done is anyone from the system can turn up wherever they are and go in and log in with their ID. We're hoping that folk will download the app, because what that will do is give a personalised plan. So it will be individually tailored to our staff colleagues. Also, and almost as important, is across the system we will have data to know what the health is of our colleagues, and where then to target additional resources. Now, all this is great, and great that we're doing it, and we're implementing this preventative and proactive culture, but how else do we get it out there, and how else do we support our managers? So what we have identified is our health and wellbeing champions, and what we know is that some organisations have them and some don't, and that there's a variation across that as well. So what we've done is we have been doing work on a system-wide approach to health and wellbeing champions. What we've done is we've got a clear package, we've got process, we've got booklets, we've got memorabilia, if you like, and we're doing our first launch on the 1st of December. And that's more to give a bit of consistency, one, to get the message out, you know, anything that's coming from the ICS down is evidence-based and good practice. And then how does it tailor into your own organisation? So all of this that we're doing is a preventative and proactive approach. But what we mustn't forget is, you know, our colleagues have been through, you know, challenging doesn't even begin to cover what they've been through with the pandemic. Our support is ongoing, and we mustn't forget the basics, you know, real basic stuff like make sure you have your lunch break, make sure you have additional breaks, make sure you ask your colleagues how you are, but more importantly, listen, and never take your eye off the ball in that relation, because this could be going on for quite a long time, and the effects of what's happened can take quite a while to emerge. So our ongoing work is to make sure we don't take the eye off the ball. If I had unlimited resources, what would I do? I would, honestly, I'd be wanting to put in the civility and respect stuff. I'd want to be making it mandatory. I'd be wanting the NHS E&I to stand up and go, today's the line in the sand. Going forward, these are the behaviours we expect if you belong to the NHS, and this is how we're going to go. And it should be about the civility and respect work, the kindness, the learning from experiences.